This is the eHealth Radio Network, your source for health advice on demand. And now your host, Eric Michaels.
Thanks for joining us once again here on the eHealth Radio Network. This is your host, Eric Michaels. eHealth Radio gives you the most current health information, news, and advice featuring some of the leading innovators in healthcare and wellness who are changing healthcare as we know it. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. Today we're speaking with Dr. Juan Pablo Frias, MD. He is the medical director at National Research Institute to discuss the role of FibroScan for clinical research programs addressing racial disparities and improving patient management and outcomes. Dr. Frias, thanks for joining us here today.
My pleasure. Thank you very much for having me.
And you're more than welcome and an honor to have you with us, and thanks for your time. So tell us, Dr. Frias, how has FibroScan impacted your clinical research programs at National Research Institute? Let's start there.
Yes, well, we do a lot of clinical trials at National Research Institute on therapeutics for type 2 diabetes, obesity, and fatty liver disease, or what's termed NAFLD, sort of the most important or most progressive sort of nature of fatty liver disease is so-called NASH. And we use the FibroScan, very useful for us in the clinic and also for our clinical research programs to help select patients that are appropriate for fatty liver disease trials. So these trials oftentimes have criteria for the amount of fat that a patient should have, the liver fat that is, or the amount of what's called fibrosis or scarring of the liver that is sometimes a consequence of fatty liver disease. And the FibroScan actually is a non-invasive test or imaging device, if you will, that helps quantify how much fat might be in the liver and how much fibrosis a patient might have. So we use it to help select patients that can enter the clinical trials as one tool in the process. And then also, oftentimes, the clinical trials actually include the FibroScan measures as an outcome of the study. So it's both in patient selection and or actual measurements that are conducted during the clinical trial. So very useful to us in our clinical trial programs.
Certainly some helpful and great information to lead things off here today. Now, what role does FibroScan play for groups looking to get into this research, and how does it factor into their participation?
Yeah, so again, patient selection, very important. I can tell you, our particular circumstance, we have a clinic, so we see patients outside of clinical trials, and then we also conduct clinical studies, and many patients who come to our center would like to be in clinical trials. So we have several FibroScans in our clinics, and we use the FibroScan on any new patient that comes into the clinic or any existing patient as one measure of the liver health, actually. So we want to sort of get a good assessment of a patient, and it's a very useful instrument for us to understand more about the patient and their liver health. And like I mentioned previously, most of our patients have type 2 diabetes and or obesity, and these are risk factors for fatty liver disease. So we use it in the clinic. I think it's very good for us to understand the patient's liver health, understand when we may need to refer the patient, for example, to a hepatologist or to a liver expert. But then also we use it, as I mentioned in the last question, to help decide which patient might be good for a clinical trial based on the amount of fatty liver disease they may have.
Now, another question for you, Dr. Frias. As an endocrinologist looking to the future when the drugs for NASH become available, how do you see FibroScan best supporting clinical practice for managing patients on treatment?
Yeah, that's a great question, and it's important for the audience to know there are currently no pharmaceutical agents that are approved by the FDA for the treatment of NASH. And there's a lot going on with respect to research. It's such an important disease to have therapies for. But so in the future, there are several ways that I would see using a FibroScan. Again, as with clinical trials, it would be useful to figure out if a patient has or does not have fatty liver disease, and if they have fatty liver disease, how advanced it is. So that may help us in deciding whether they need medication or not, or which medications they may need. So that goes into sort of the diagnosing of the patient and figuring out if they need future drug or not. But also very importantly, then in following the patient. So we want to know, we're treating them with a medication. Is it having the effect that we'd like to see? And again, I think here's where the FibroScan potentially plays a very important role in following the patient over time. So I think we want to see that as clinicians to see if the medications are working. But I think also the FibroScan provides a lot of motivation to the patient as well. So they can actually see a report where I can use that report to go over with the patient what the issues are. And over time, we can actually see that this is improving. I think it motivates the patient. And with respect to medication use, I see it as being a tool that could help patients with adherence of taking the medication and persistence with therapy, continuing with their therapy. Now, that said, although we have no medications today for the treatment of fatty liver disease that are approved, probably the best sort of intervention that we could take with our patients is that of nutritious diet with weight loss and physical activity. So what's been found in clinical research, and that we see in the clinic as well, is that weight loss is a very, very important way to reduce the fat in the liver. And I think that's something that we currently use the FibroScan for, to help motivate patients and determine which patients really need to lose weight even more because they may have fatty liver disease and potentially more advanced fatty liver disease. And then we can follow those patients, and we see very nicely as they go losing weight, those FibroScan scores generally improve. And I think it's very motivating to the patient and very good for us to know that this therapy is having an effect.
Thanks for the clarification on that. That is much appreciated and also quite helpful in the information shared so far. Today we're speaking with Dr. Juan Pablo Frias, MD. He's the medical director at the National Research Institute, and he's joined us here today on eHealth Radio's Health News and Technology channels, a part of the eHealth Radio Network. Now tell us, Dr. Frias, as well, what is the ethnic competition of your patient population, and is having access to FibroScan important for this population, or access to healthcare services in general? I'd like to hear your point of view on that.
Yeah, so our population happens to be, we're an underserved area of Los Angeles. We're in Los Angeles County. So our population in most of our clinics is primarily Latino or Hispanic. And as it turns out, this is a population that has a much higher risk of fatty liver disease. So when we look at sort of risk factors for having fatty liver disease and NASH, they include obesity or overweight, having type 2 diabetes, having high blood pressure, having abnormal cholesterol and triglycerides, but also very important is the patient's ethnicity. And then Hispanic patients have more type 2 diabetes, tend to have more obesity, and tend to have more fatty liver disease. So I would say in a clinic like ours, it's important, I think, with all populations, but in our clinic in particular, because these are very high-risk patients, and it's very important, like I mentioned previously, to know what the status of the liver is in these patients, because, and I think it's important for the audience to know, this fatty liver disease actually will be the leading cause of liver transplantation. It's estimated by 2030 in the United States, and it already is the leading cause of liver transplantation in women in the United States. And this is even more so in patients that are Hispanic. So I think it's very relevant to our clinic, and it's important for us to have these instruments to, again, assess liver health in these patients.
Yeah, no doubt about that, and quite interesting as well. Now, where do you actually see this going in terms of management and improving outcomes?
Well, I think having a tool like this to make the diagnosis is, or I should say help make the diagnosis, it's not just made with a FibroScan, but it's a very important component of making the diagnosis and figuring out which patients should see the hepatologist, which patients may need a liver biopsy, et cetera. Fatty liver disease is what we would call a quote-unquote silent disease. It usually has no symptoms. So oftentimes we'll find it just sort of by accident, if you will, by noticing that liver tests in the blood may be a little bit high, or a patient has an ultrasound for another reason, and the radiologist finds that they have findings that are consistent with fatty liver disease. So if you don't look for it, oftentimes it may go undiagnosed. And it is progressive. So you can have fat in the liver and be sort of okay, if you will, but it oftentimes progresses progresses to NASH, which is a more serious form of fatty liver disease, and potentially to cirrhosis. So going back to the question, I think having an examination like a FibroScan helps us diagnose patients early so we can intervene before there's been progression. And so that can certainly help improve outcomes. I would say also knowing how advanced someone's fatty liver disease is very important as well. And I'll give one example. Patients with fatty liver disease, if they progress, they can have complications from the liver effects of having the fat in the liver, but also they're very high risk of cardiovascular disease, so stroke, heart disease as well. So we get even more aggressive in treating their cardiovascular risk factors, like improving their cholesterol, improving their blood pressure, improving their body weight, making sure they're not smoking cigarettes. So I think it's very important to diagnose this, to be aggressive about treating it, and that's where FibroScan plays a very important role. And as I mentioned previously, then, I think very important in following whether the therapy is working and also helping motivate the patient. So if the patient is more motivated by seeing improvement in these results, they likely will continue to work on their weight loss than if they weren't motivated. And if we have a way to track to make sure that actually the therapy is having an effect, I think ultimately we should improve outcomes as well.
Well, it certainly makes a lot of sense how this can help. In fact, we've spoken with several other doctors and other practices that are using this technology and seeing great results and a lot of input and positive results being seen. So thanks so much for joining us, and really appreciate what you're doing there in your region in Los Angeles. If listeners wanted to get more information on this technology, where's the best place online to do so?
Yeah, I would say echosense.com. So that's ECHOSENS.com, and that's the manufacturer of the FibroScan. And in fact, we've recently written a white paper, which is a paper that could be downloaded actually and read from that website. I'm speaking about early detection, and again, as I mentioned, the importance of healthy diet and lifestyle changes, which can help actually not just halt the progression of fatty liver disease, but really reverse it if there's enough weight loss. So I think that's a nice paper for folks to download and to read.
And again, listeners, for more information on this technology, simply visit echosense.com. Of course, we'll leave this link within the show notes of this broadcast to make it convenient as well. Dr. Frias, thanks so much for joining us here today on eHealth Radio. Much appreciated.
Absolutely. My pleasure. Thank you very much.
You're more than welcome anytime. We've been speaking with Dr. Juan Pablo Frias. He is the medical director at the National Research Institute. And for more information on the FibroScan technology, visit echosense.com. And again, this has been your host, Eric Michaels, and we do thank you for your continued support of the eHealth Radio Network. Join us again soon for another episode that will help further expand your knowledge on those things that are important to your health and wellness. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. And as always, we do thank you for tuning in.
Thanks for tuning in to the eHealth Radio Network. For more information or to subscribe to this podcast, visit eHealthRadioNetwork.com.